George Weems Memorial Hospital Board of Directors meeting, our vision of providing quality care close to home. The date is February 26, 2026. Please note this meeting will be on video and audio recorded. Call to order. We do have a quorum. I'd like to have Mr. Walker to take over, a moment of silence for Miss Jean Power.
Yes, we'd like to have a moment of silence for Jean Power. Was a nurse that worked with the hospital for many, many years. She passed away, and so we would like to have a moment of silence for her. Also, our condolences to James Osteen. His father passed as well. And we had about 2 other staff members that have family that passed, this month. So, we just take a moment of silence for them. Thank you.
Thank you. I appreciate that, David. Next item on the agenda is public comment. Do we have any public comment? If so, no. The next item on the agenda is the approval of the minutes. I'd like to do one thing, though. I hate to say this. I really need to be out a little earlier today. And if we have any particular things we would, I know the board discussed, but maybe some in-depth stuff to discuss about particularly the financials or other stuff. Let's kind of keep them, maybe call back later or talk to Mr. Walker about that. I'd appreciate that today. I got to pull that out of here. Next item is approval of the minutes from the last meeting. Do I have a motion to approve the minutes?
Motion.
Do I have a second?
Second.
Any discussion on this? If so, all approved? All in favor?
Aye.
All opposed? None. Next item, customer service. How we doing customer service?
Customer service is a journey, which is good. We just implemented and we just implemented 3 things at the hospital. Will be the 3 B's, and I have that part of my update to you. The 3 B's: be kind, be courteous, and be compassionate. And so we want that to be not only with our patients, but with each other. And even as a board, we need to have 3 B's in place here, that we're kind, we're courteous, and we're compassionate, because many times we don't know what our fellow board members or even co-workers or patients are going through. A lot of people go through a whole lot of different things. And with the number of deaths that we've had and our our employees been going through, so if someone can be kind to them, a co-worker, be courteous, be compassionate, goes a long way. So we will be implementing the 3 B's. One of the things that we do always, many times we try to remember, we had a person that was in the hospital, community member that passed away. We'll send those individuals some flowers. So we try to do flowers and cards, but we'll do that even a little bit more. But Craig Gibson, he's not here today, but part of his report, he has implemented an environmental service technician perspective, AIDET, and you all should have this in your package. But it means, when they come in the room, the cleaner room in the hospital, they should acknowledge, with a friendly smile to the patient, introduce themselves, tell them their name, that they're with environmental services, let them know how long they've been in the room cleaning, and then explain to them what they're doing, and then when they leave, say thank you. So just the little things that, we're trying to do with customer service. As part of my report, Duffy and I will be doing a presentation at the Line Governance Board Retreat on patient perspective, customer service, and compassionate care. And so we'll be, talking to the other hospitals, board members and CEOs about what we're doing here. But customer service is a lifestyle. It's just not an event. So you just try to do something each day, just to go above and beyond. Just 1%. If you can do that, that is okay. And sometimes we miss it, but still we got to continue to do it as well.
Okay, I believe we talked about something too. Are you thinking about writing little handwritten?
Yeah. So Duff and I had a conversation, about, when individuals, leave the hospital, Probably writing, a handwritten note, or sending them a note. Thank you for, coming to Weems Memorial Hospital. We're glad we're serving you at this time. If you have any other needs in the future, please let us know. So we're definitely not talking about that. Maybe implementing that, with the patients that stand in the hospital.
My generation likes little handwritten thank you notes. To me, that's special. That's better than sending something on the internet or something like that.
And customer service goes beyond. I just want to reiterate this. Weems, we're 3 pillars. You got the hospital, you got the clinics, you have EMS. Customer service goes beyond just the inpatient unit at the hospital. It goes beyond the ED. It goes into the clinics. Even with EMS, is part of customer service. Situation happened a few months ago. James and I talked about it, and we went out to visit the family. That's part of customer service. And so it just goes beyond when you think of the hospital, people that's staying at the hospital, inpatient. Because you have these 3 areas that people go to the clinics. You know what I mean? They want to be treated in a good manner. And the clinic part, we'll be doing coffee stations there. Part of our customer service. When people come get blood work, they don't drink anything, before the blood work, but after the blood work, they're very hungry or tired, so that coffee will give them a little spruce up. Susie came up with that idea. And so, that's part of customer service. And I would talk with James. I had a thought, for EMS, is that, we can do some callbacks, to some families, who have used our service, just at random. Just say, hey, how was the service? We know we serve you. And how do we do? If I can do anything, my name is James Osteen, EMS director. We just here to provide this service. So just feedback in all 3 areas, just not the inpatient unit. Because it goes from the front desk to the emergency room. From the inpatient unit, anybody that's touching anything to do with patient care areas, even us. Customer service is doing something. Yesterday morning, I went up to the front office. This gentleman was getting his mother out of this big truck. He was looking for a wheelchair, so I went and got the wheelchair. And rolled the lady in. Those are things customer service is all about. So it's ongoing. A lot of little things. Just the little things. And like I say, sometimes, we may miss it because customer service is not only doing something but also answering complaints. That's a part of customer service as well. And so we just want to make sure we just do what we can, one step at a time. Sometimes we do miss it. We got to do what we got to do to correct it.
I think if you take actions on complaints immediately, I think people are satisfied. And you need to thank people for complaining to you.
Yeah.
If it's, and everything. Well, one more question. Courtney, what have you done specifically with customer service with your nursing crew? I'm going to put some people, I'm driving this now.
Okay, I already deal with complaints all the time. We already do the callbacks. I already give patients, families, my cell phone number every time. Go visit them within 24 hours of admissions, and multiple other things. I'm dealing with one right now.
And then the flowers.
How about everybody walking around with a smile?
And flowers. We have thank you notes that have Weems logo on them. In my office, I have 6 currently going right now for different people that Melanie's mailing out for people that have been patients of ours or staff members who have lost loved ones. So,
let me just
let's make that our signature.
Yeah, let me just say this also for Courtney. We had a complaint came in. A person had one complaint about one thing, but she was so happy with all the other services that we provided. So I went to talk to Courtney, but Courtney had already talked to the people. Just follow-up calls. And so that's something that, like I said, it's ongoing. The more you do it, the better you become at it. But it's a work in progress, but it's the little things, really.
We got to stay on it. Okay. Thank y'all. I'm really, any board members got any? Y'all think this is a good idea, the customer service? Yes. And customer service is staff being nice to each other, being nice to vendors. All right. Mr. Walker, employee of the month.
Yes.
I didn't say you were employee of the month. I said please announce.
Well, yeah, because we have a policy, I made a policy statement that the directors and administrators cannot be employed of the month right now because we want to focus on the employees right now, although they do a good job. So I know I'm not employed of the month. My employee of the month this year is Kim Westbrook. Kim, come on up. I'm gonna read something about Kim. You know, I'm gonna read this, and she's a blessing. You know, Kim is a blessing. So Kim was nominated. It says Kim came to us after working with Dr. Sanala, acquiring great experience. Kim works at our East Clinic and is a great fit for the larger clinic setting. She's always professional in her interactions with our patients, healthcare professionals. She brings a warm smile and friendliness to our patients. Kim is fantastic with her coworkers, is always ready to help out, looking forward to her retiring with us. So Kim has been with us. She's been a nurse for a while, but Kim always have a good demeanor, just a nice demeanor. Sometimes I do a pop-up walk at the clinics, you know, because they don't know I'm coming. I'm just walking through, and she's doing her work, but she's always pleasant. You know, it's not like, you know, you look at them, hey, how you doing? And they always got a whole 1,000 words to say and be angry with you. But Kim, you know, you're a joy to work with, and we're very fortunate to have you here.
Thank you.
You know, so we greatly appreciate you. That's Kim Westbrook. Let's give her another hand clap.
Wait a minute, Kim. Kim, you've got 10 minutes now to, thank you.
So this is it. Oh, let's get a picture. Okay. All right. Let's get a picture.
Let's get some pictures. Let's go in the newspaper.
So this is just a certificate of recognition as Employee of the Month, Kim. And then we got some gift certificate to the Apalachicola Chocolate and Coffee Company and Izzy's Cafe.
Wonderful.
Okay. Kim, thank you for coming.
Thank you. Thank you.
So when you talk about this, like an individual like Kim, you know, and that's why I say people go through a lot and they still come to work. Even when they're hurting, they may have things in their personal lives, but they still come to serve our clinics. And now she got to run out because she has to get back to the clinic.
I got to turn my phone off too, y'all. Just a second here, I'm sorry. I don't want it to go off in the middle of the meeting, like somebody I know. I hope it's off. Makes some weird sounds sometimes. Okay, next item on the agenda is Mr. Kirschenbaum, the interim airport manager, to give us an airport update.
Hi, Steve Kirschenbaum, Airport Manager, Appalach. I had a little PowerPoint ready for you, but we couldn't get it in, so I'm going to kind of wing it right now. But I'd like to thank Weems Hospital for saving my wife's life 5 years ago before I even start talking about what I need to talk about. My wife hemorrhaged after surgery at TMH locally, and your EMS crews gave her an advanced life-saving drug, TXA, and scheduled an airlift out of the county and saved her life. And at the time, Mike Murphy, who was your EMS director, told me that he never got to give a hug to a person who left in a helicopter in the shape my wife was. So thank you for saving my wife's life. Second part of it is an air ambulance became near and dear to my heart, that air ambulance had to respond out of Perry to come to our remote area. And the nearest ambulance we have now is in Crawfordville. They don't need an air ambulance in Crawfordville. We need something here. With David Walker's blessing, we sat down, had a couple meetings with AirLife. I sat down with my airport board. Now as airport manager, I'm in a position that potentially with the county, we could do something about this. I sent in a grant application to Florida Commerce with their job growth grant for projects at the airport, but I included a 60 by 60 hangar for an air ambulance company, letting the staff at Florida Commerce know that we are 2 hours removed from a major trauma center, and it's something that Franklin County desperately needs. The thing that we have to do on an airport level, Commissioner Amison wants to be a part of this. Your CEO wants to be a part of this. They need a 30 count of extractions monthly for it to be a worthwhile proposition for them to come out of here. So there's going to have to be some kind of partnership with Sacred Heart, with surrounding counties, but I believe if that air ambulance is here, I think we're going to get a 30 count out of the region.
Yeah, and just so Steve, I did have a conversation with Air Methods, the guy that served our area, and it just wasn't profitable enough for them to be in Franklin County. Now, they are moving to Calhoun County, because Calhoun County has a new hospital, and there's a lot of momentum there. And so they feel that they can get their numbers up with a newer hospital in that area, because they're close to Jackson County as well. And then, I did tell them, hey, we really need you here, because most of your calls are coming from Franklin County. But at this time, on a corporate level, his bosses look at black and white, and they look at what's going on in Calhoun County with the new hospital there, and there's a lot of momentum there. So they're going to begin to go to Calhoun County, but we still having hope to get something here as well. So I just want to let the board know.
And I think if we push and do it creatively, and if we have a team of people working to make it happen, I really think we could make it happen, especially, in Crawfordville right now, they're on a patch of grass. I'd be talking about a hangar with offices, with access to an airport, near 2 hospitals. I think we can make it happen. We just got to get a little creative with it. So I'm trying to work on that right now. I'll let Mr. Walker know as soon as we have approval on the hangar, and then we just have to make Franklin County an attractive place for this company to set up. But if I was ambulance director and I had somebody critically injured in Franklin County, and I knew a helicopter from far away is going to respond, and the option is to put them in an ambulance and run over to Sacred Heart or do whatever we're going to do, that's what I'd be doing. And I think the count would seriously climb if we had the ambulance here. So,
What would you like the board to do? Is there anything we can do? What do we need to do, or you just going to work with Mr. Walker, or?
I think we need to forge some kind of partnership with Sacred Heart and see if we can get them to support what we're trying to do here. Mm-hmm. And at that point, and also come up with some creative fiscal ideas to sit down and crunch the numbers that it's going to cost them to operate out of here, and it's substantial. But try to figure a way that possibly we could offset that. So,
how many more calls did they have over in wherever they want to locate as opposed to here? Did we ever ask that question?
Well, in Calhoun County,
you got a brand new hospital, I understand.
Yeah.
Bright and shiny.
Yeah.
We could too.
Yeah.
But that's not the question. The question I'm asking is, how many calls have they had from that county, which I would assume is probably, about the same size as this county with regard to population?
It's a little bigger, but I think he told me that, they need to get 30, and they're probably around maybe 24. They're flying out in Calhoun now, around 20 to 24, so they feel they can get that 30 easily, with the new hospital there, and then, with help from Jackson County, because Jackson County, they may not be able to fly. One helicopter may not be able to fly to Jackson County all the time, so they can pick up those flights as well. So they already up to about maybe 20 to 24, he was saying, and we can confirm that number with him again. But so he feels that they already almost there in Calhoun County, and then with Jackson County, that's a big county, and so the helicopter company there can't fly all the time, but they can pull from Jackson County as well.
I think that we should also task our EMS director to contact the EMS departments of the surrounding counties to get a count on their extractions and see how many that potentially could piggyback off that ambulance being here. So I guess that's all I have to say, but I'm trying to work on it.
There's another part to that equation, and that is, where are they getting? Are they picking them up at that hospital and taking them someplace else? Are they having to fly somewhere to get them and bring them back to that hospital? And if so, how many extractions, as you call it, are in the different counties surrounding, and where would the central location be? I've always thought that we would be the central location for all the surrounding counties, but
I agree.
Yeah, it makes sense,
well,
but,
those are the type of questions that I think we as a group should be asking them.
well, they'll fly out of, they will fly out of Calhoun County at the hospital there. The hospital, the area, Calhoun County around the hospital will be their base there. And then, like I said, Jackson County, is a very big county.
It is.
And they have the flight data. Tommy Cochran, I think that's his name. And we can invite him maybe at our next meeting, if we want to, to come talk to us about it. But they crunch the numbers and they feel that they can hit that 30 mark quicker at Calhoun, brand new hospital, and you got Jackson County there, big county as well.
And a question for you as well. When I was crunching this with Mike Murphy 6-7 years ago, he was extracting 3 to 4 people a week out of Franklin County. Why is the number so much lower now? I'm just wondering.
James, what's that?
Why is the
Making
number,
more trips.
7 years ago, the number was up at 3 or 4 extractions a week, and now it's down pretty low. I'm wondering
You probably
what
had-
changed.
You could have had 2 ambulances back then. I know, we had more.
They also need to be appropriate for that, for transfer via life flight, because we get pushed sometimes from EMS and different departments, they want us to fly them, but if it's not necessary, then we don't need to fly them. That's up to the physician. So I don't know if that would be anything that happened. I remember your wife's situation. I worked here then. I remember when
Oh,
Mike
God.
Murphy was here and all that happening, and she was obviously an appropriate one. But they have to be appropriate patient, and their status at that time has to fit that to be able to fly them. Otherwise, I mean, from our side at the hospital, if we already have them somewhat stable and such as that, then it doesn't save a whole lot of time if they're at the hospital already, unless it's a very emergent situation. It'll save us a little bit of time, but by the time we call them, they launch and they fly here, then they come in, it takes them a good minute to get all their equipment on them, get them back, and then fly them back. Sometimes if EMS is available, we're not saving much time.
The other option could be, and this is a crazy option that I was working back then, is at the 2 or 3 or 4 extractions a week at $30,000-$40,000 a pop, it amounts to millions a year. What about if Franklin County Sheriff's Department had a rescue helicopter, had EMS people locally, and we staffed our own thing? That's another option that was in my head. But I think that if we did that, the money would go back to the county, and we could provide mutual aid to the surrounding counties. But that would be a very complicated thing to put together from scratch as laymen in the industry. But I'm going to keep on working it and see if I could come up with something with David where we could get the count up and maybe do a partnership with Sacred Heart and see what happens. I mean, are they etched in granite in Calhoun County, or they're just over there now, right?
Yeah, they have something in Jackson County. Calhoun County has another agreement with another flight company, and that flight company, Bowling may know more about this than I do, but, they'll be ending that agreement with that flight company, and so Air Methods will be then their preferred vendor
Right.
at that time, yeah.
All right, so I guess we got to find out, and maybe we can find that out through your EMS director, how many extractions are coming out of the surrounding counties, add that number, and maybe see on the Weems side how we could possibly get the number a little bit higher,
Sure.
But, all right, well, thank you very much, and I'm trying.
Have you talked to Sacred Heart at all, at least broached the subject? Are they interested in partnering? Would they be amenable to an arrangement like that?
Commissioner Amison was doing something. I don't know, have you spoke to Sacred Heart at
No,
all?
I haven't, but I can talk with the administrator at Sacred Heart. I know her, and I'll have a conversation with her. But I know Gulf County, they barely fly anybody. I think I was talking to Tommy Cochran, and James probably can come up and mention that. I think Gulf County flies, what, James? 1 a year.
Yeah, they just transport a very large percentage of theirs to their sister hospital Bay, and the distance is not long. I mean, so you're not going to get a chopper there. If the destination is Bay Medical or something of that acuity, then they send most all their patients there to Bay because it's Ascension.
Yeah,
So it's like I think James said one a year. So Gulf County is really not. Franklin County, out of your surrounding areas here between Franklin and Wakulla, Franklin is we're doing most of the flights out of here, for that company. And so that's when I was talking to Tommy Cochran, I'm like, hey, we're already flying out. We're giving you all this, individuals to fly out here. You're not getting that much in Wakulla. Wakulla is dead pretty much. Gulf County has been low as well. So the idea was that, hey, if you're here, the airport manager, working with you for a hangar, we're rolling out the red carpet for you, whatever we can do, we want to make sure you're here. I said, is there anything that we can do? What can we do right now, to get you here? And he just told me, well, David, the higher ups looking at numbers, and they figure that, with the new hospital in Calhoun, they're already around the 20+ mark. We feel that we can get that 30 mark there, easily there.
Well, I think the biggest thing we could show them is getting our numbers up.
Oh, yeah.
And then at that point, we could turn around and talk. And the same thing with Sacred Heart, if we could get them on board, because the half-hour ambulance ride or 45 minutes that they have to their hospital far outweighs sitting there waiting for a helicopter. But if they knew one was local, I think we would get traffic out of Sacred Heart as well.
But I'll reach out to Sacred Heart, the CEO there.
I'd be looking at what we have spent in overtime and ambulances out of this county and why we've had to use it, and then look at what type of subsidy that could be brought to the table that would subsidize that air rescue system and make sure that we had the best service around.
That's a great idea. And what they had told us too, if they were based here and there were no airlifts at that point in time, and we needed their staff to respond to something locally, they would be amiable to that too.
Because this EMS overtime and out of the county and not being available is what's causing us to not have those flights out.
Right.
Yeah,
Right.
and so the second thing, you look at what would be the subsidy be? So the subsidy would then, you look at what we have to pay, that will come out of the healthcare side of the trust fund, right? Which EMS is coming out of there now. And then what will be left over for the building of the addition of a hospital? Because that's going to drain that as well. So we can look at how much will it cost us. That's why I was asking him, how much will it cost us for you to be here? Just give us a number, and then we can go with that. And I'll continue to talk with Tommy Cochran about that. And then the county have to make a decision then. If you say, David, it will cost us $300,000, we need a $200,000 or $300,000 subsidy from the county to be here. Then the county then will have to say, okay, we need to take that money out of the healthcare trust fund side of things. And then the flip side of that, as that fund begin to go down a little, what would happen to this hospital, that we're supposed to try to get built for 20 years? Next year will be 20 years, excuse me, next year will be 20 years, that the sales tax agreement was filled out. And so those are some things that got to be worked out. How much will it cost us if it's $300,000 a year? And then we know that that's going to be hitting the sales tax trust fund, healthcare trust fund for that. But at least we'll know. But he hasn't given me that number yet.
Before I leave, what could we do short-term right now as a hospital to get the count up? What could we do differently right now to get our count up?
And Courtney is the director of nursing. The only thing we can probably do if we see something, if they come to the hospital, instead of calling EMS out, you call air methods to come in, but that's a physician kind of deal for that.
Yeah, I would think, I don't know, James, because I don't know the numbers, but I mean, most of the time, we don't fly many from the hospital. It's just really not necessary. We flew one this week, but it just doesn't happen that often. Usually we're able to stabilize them and get them on a truck and get them there. And so it would just depend on the acuity of the patient, and it would also be the same if James was flying them or not in the field as well, because if he can get them on the truck and stabilize them and move them quick, it just all depends on the acuity of the patients.
Well, Courtney, part of the acuity of the patient, wouldn't it also relate to the insurance? So they want to make sure that the insurance is going to cover the ride and it's not coming out of the patient's pocket, right?
We don't even think about insurance when we're we just do what's best for the patient and figure it out later. And they have the law that covers the flights and the medics as needed, and it depends on the destination. The one we flew this week was not Panama City or Tallahassee, so obviously we're not putting a truck out that far.
No.
So it depends on the acuity and the need of the patient and then where they're being transferred to.
And I think one other item, during our seasonal months when the tourists are here, a lot of the tourists have disdain about using a hospital, period, on the Panhandle. I think that the count would go up substantially during the summer if the summer folks were given the option, if you want to go back to your hospital, but that's another thing too that I
Yeah.
just thought about.
Because even when you do all of that, when you look at EMS, EMS would be, the county would be, they subsidizing EMS now out of the healthcare sales tax. And, it's a two-edged sword in a way, because when you take EMS rides away, EMS get paid by mileage. And so, there's a revenue issue. So it really got to be balanced. It really have to be very balanced, that we don't deplete the budget for EMS revenue-wise, with this. But now that they're getting paid out of healthcare sales tax, I guess if we depleted, that sales tax will pick it up. But that's just something to think about, the revenue part.
I didn't follow that.
Okay, EMS get paid by, the majority of EMS, and James can come up for this, the majority of EMS revenue comes by mileage, right, James?
We get paid a base rate
Base rate.
from ALS or BLS or whatever. It's a
Yeah.
base rate, and then it's X amount
Yeah.
of money per mile.
Yeah, and so if EMS mileage goes down, the revenue goes down. And so we got to make sure that we cover that revenue. If we fly out more, that's revenue that's not going back to EMS. So we got to make sure that we cover that budgetarily wise for EMS. You understand that, what I'm saying? Meaning that
I
if
understand it, but I may not disagree, I may disagree with the way it's balanced.
Okay, so if EMS do 50 runs, and then when we start flying them out, they begin to do 20 or 10, that 40 runs that we used to get paid for, we're going to have to subsidize that.
It's a deficit.
That's financial, that's all I'm saying.
I got a foolish question. So we'd have a contract with a company, right? A flight company. Are they paid a flat rate or per flight, or how are they paid, Mr. Kirschbaum? How are you pay them? Do you pay
I'm not sure, but when
X amount a trip, or are they paid?
I think
like a
some
retainer
companies-
fee to be here, huh?
I think some companies, they have a flat rate, some they charge by the mile. I'm not 100% sure, and that should come from the ambulance company. I'm not sure about that.
Well, we need to know that.
I'm not sure exactly. I imagine they have a same, basically like we have. We have when we bill out, you have an ALS rate. ALS, there's a couple different. There's like ALS 1, ALS 2, BLS 1, BLS 2, different rates, and then the mileage from say patient's house to the hospital. That mileage, and that's what gets billed to the patient, or to the patient's insurance.
I'm going to ask them one question this week. How many people, how many folks, what will it cost you to operate here with no extractions? What's your
I
cost?
think that's a good idea. I'd be curious about that.
Yeah.
I mean, I think
And
that's good.
this way, maybe we have a number that we could work backwards from and maybe ask the county for help. Because this is something so important that this county needs. And people have died because of not being able to get out somewhere in time. But thank you very much for the time, and thank you, Mr. Walker, I appreciate it.
And I think when Steve is leaving, it'll make, the county health system in a whole more rounded. We had a helicopter here in our county, really. It would just make, what we want to do here, really well-rounded here, so.
I think that's a good idea. I mean, I don't quite understand it, but if that would be nice to know what you just said.
Neither do I. I'm trying to wrap my head around it a little
Okay.
bit. But
All right.
thank you so much.
Thank you. Anybody got anything else? Okay, next item is clinical services report. Courtney Alford.
Good morning. I will say we've been busier lately, so you should see increase in numbers the emergency department, swing beds, inpatients. Trying to find somebody to work tonight right now, so that's good. I mean, it's good. Our new hire,
How many we got in rooms?
6.
6 in rooms right now?
3 swing beds, and then the 4th one should be admitted to swing bed today of the
Wow,
6. So.
good.
And the new hire RN starts full-time this week that we talked about, she was gonna, the one RN, and then we've put out, Christy Terry has put out some stuff on social media about some CNAs, which we haven't had CNAs in 10+ years, but we're looking for extra hands that can help out, so we put out for CNAs, LPNs, and RNs on social media with Christy Terry's help, and Melanie has received quite a few in the last few days since that posting, so thankful for that. We're still working on that hospice open house, so I'll keep you posted on that date. We did have the hospice meeting on the 11th at the hospital, and then Colleen did meet us from the foundation so that we're working with them to try to get that sofa bed or sofa chair for the patients and getting that worked out. We currently have a hospice patient now, so we've been keeping that room pretty busy, so trying to help the families where we can. We also have some artwork going up with the help of Colleen, and so I'm sure I don't know if she's going to speak about that today or not, but we're trying to improve the patient rooms as part of our improvements. We need to get some new chairs. We've been working on that, getting some new chairs for all the patient rooms and some artwork. Just a little local, colorful art. So people laying in the bed for days, they have a little something to look at, and makes it a little more pleasant. Other than that, I don't really have a whole lot, unless you guys have any questions.
Courtney, and since Craig is not here, but I want to just add this part of his report. We have a capital improvement grant to change out the bathrooms to bring them ADA compliant, and so that's going to help Courtney, in the med surg unit as well, and we'll talk about that. But also, this is part of my report, but it goes with clinical stuff. The Florida Department of Health's Bureau of Public Health Pharmacy is developing a pharmacy residency program and seeks to collaborate with healthcare organizations across Florida. And they will begin to have, when they develop this program, they will offer rotations, coming through the different hospitals. And they reached out to me to see if we would collaborate with them, to be a part of that program. And so that's clinical. I mean, when these pharmacists get trained, Weems can be a rotating site. And my idea, when I was talking to the Florida Department of Health about this, is that as we look to do the retail pharmacy and care bill, can these pharmacists help us out with that? So that was, I just wanted to mention that because that's part of the clinical part. And we'll be meeting with the Department of Health in the next upcoming months, to talk more about this pharmacy residency program here that they want to do in the state of Florida. So I just want to add that. I want to add that because it was part of the clinical piece.
Courtney, what do we attribute these increase in the swing bed to?
Let's see.
Is it our effort going out there, or is it something else?
Yes, so these patients, I'm trying to think, the ones that we have, one of them came from two of them came from another facility, and 2 of them came as admissions through our emergency department that needed swing bed. So, I will always say that I think that admissions from the emergency department of weakness, UTIs, falls, all those things turn into swing beds, turn into swing beds. So I think when you increase a number of admissions, and then you're going to increase your number of swing beds, potential swing beds.
Anything else? Corey mentioned something right quick. I'd like to run this by y'all about what all we're doing to keep our hospital viable. And, I think we've done a disservice. We complain all the time that we got an old hospital. I think we have a historic hospital that we are by leaps and bounds bringing into a lot better. We got new floors, we got new painting, we got this, we got that. So just don't complain anymore about being old. We complain about it, right?
So instead of saying old, we're saying historic now.
It's
right?
historic, okay, and it is, but it's not old because we got new windows, we got
But
The
not-
floors look
yeah,
great.
Not a whole bunch of
I
windows
mean,
now.
I can-
We getting a
you
grant
know,
for new
so-
windows though.
Let's don't, we do a disservice by calling it old. It's
So you're
historic.
historic then?
I'm historic. Okay, thank you. Thank you. All right, anything else? Okay. Next item's, the medical staff report. Dr. Conrad, I don't see him here.
He's working a shift in the emergency department today.
Okay, all right. He'd be here, he'd figure out something if there's any issues there. Okay, the next item's EMS update.
Good morning. All right, the application process for the new EMS director ends tomorrow, end of day. So I'm confident we should know who the new county EMS director will be within probably the next 2 weeks. The application process for the EMT, paramedic and captains are currently underway. The extrication tool has been delivered. We do have possession of it. It is on the QRV now. I do need to purchase some gear. Well, I'm gonna get with Mr. Walker later on that. Right now, we're looking at about $175 a set for the coveralls, gloves, helmet with eyewear, with eye protection. All right, overtime last month from 126 to 222. I had a total of 252 hours of overtime because of 312 hours of call-outs, and for a total of $9,793 in overtime. Looking forward to that getting much better this month. We're fully staffed again. I've got everybody back. Nobody's out hurt. Of course, everybody's going to take some time off occasionally, but hopefully it'll be a lot better. That month, we had 3 ambulances all but one day. And then one day we had 2 ambulances in the QRV. We are currently ahead of last year's numbers with 85% transports to 18% refusals. So far this month, we've had 93 billable runs and 16 non-billable. Last month of this time, or last year this month, we had 72 billable and 27 refusals. So we're ahead of the game so far. Yeah, if y'all don't have anything else, that's all I have.
And what and just, James, just explain to him, just billable and unbillable.
A billable call is one we charge. That's the money we bill the patient, or bill the insurance company, whomever.
The transport.
Unbillable is a refusal. The patient doesn't want to go to the hospital, so we don't send them a bill. So that's where we're on that. Now, there are some other factors in there for the total number, but those are the ones that, and I put them in here because they're the canceled en routes. If there was no patient contact, I don't put them in here.
James, is there any way you can increase the billable? Is there anything we can do that would reduce that unbillable pickups?
Oh, well, I mean, considering we're at only 18% unbillable,
That's pretty good.
a whole lot better than it
That's
was
pretty good,
this time
yeah.
last year. I mean, last year this time we were probably at about 35, 38% unbillable.
Okay, so you have reduced, and what do you attribute that to, you think?
Our education and our medical director, if it's a questionable, if there's somebody that really needs to go, doesn't want to go, we call them, let the patient actually talk to the doctor.
Mm-hmm.
So a lot of times that can influence the patient to go ahead and go to the hospital.
If they need to go, that's good, the doctors tell them that. They want to hear from a doctor too, don't they?
Right.
Okay.
All right, great.
Anything else? When's that conversion over to the county?
April 1st is the conversion.
It's a month away.
It may be stretched out a little further.
That's fine, whatever.
It could potentially be the middle of May or the middle of April, maybe even May 1st.
Whatever,
We're
that's
still
fine.
working on that.
That's good, that's good.
Okay, we just
That's
need,
just a-
because we
That's a
budgeted,
moving target, that's okay.
yeah, it's moving, but I think we budgeted to go beyond April, right? Do y'all remember? Oh, okay.
Are we fully staffed?
Yes, we are fully staffed.
Well, good. Very
How's your
good.
overtime this month?
You just said that.
Like I said, the overtime for this 126 to 222, which was a couple days ago, we were at, we had 252 hours of overtime, but I had 312 hours of call-outs. So I had to cover three, which was $9,793 worth of overtime. This month, this coming from the 22nd forward, it should be a lot less because we are fully staffed. I have nobody out injured, nobody right now out sick. Of course, it all depends on, somebody takes vacation days or somebody calls out sick. It's just.
Yeah,
And-
that's understandable.
And
Thank
hope-
you.
And hopefully with James, with going to the county, he can build a reserve. I think John and I was talking about this, if they have a person that, maybe part-time that, if you got people that's out, these people can step in and work for them.
And currently I have 3 part-time EMTs, but I have 0 part-time paramedics right now. So
Okay,
the
good.
paramedics are hard to come by.
Okay, thank you.
Next item on the agenda is the clinic update. Susie?
Good morning. We're
Good
going to make
morning.
this short and sweet so you can get out. Dr. Dixon has come back to the clinic setting. He's got 4 days throughout the year booked up there. So Dr. Dixon is the OBGYN that goes up to the Carabel Clinic. It was a great success for his first day back. So we're going to be working together with his CEO to try to get some of the marketing out. So the more patients that come in, the more that they'll come down and service our area.
Okay.
So that was a great thing. Our main provider up at East, Dana will be taking a little vacation, but we have it covered. So the numbers will be down at East for March. But we have a little bit of coverage, just so people know, though. We have, whenever one clinic has a little bit of a downtime, the other clinic is available, so patients can come to either clinic. It doesn't matter, insurance is covered at both places. But typically January and February are slower times anyway. And so leading into March is when it starts to pick up when the tourists come in.
Susie, just going back to the OBG, is that going to be prenatal care is they providing?
I believe Dr. Dixon mostly does just GYN services. And I think, once we get the marketing going and there's more interest, then maybe he may be fluctuating, but I can't speak on their behalf. But if they see the interest, and they know that there's a need down here, then
Well, I think there's
Certainly.
sorely a need down here that a lot of people don't get to see because of the travel distance
Yeah.
to get to an
Right.
OBGYN. There's no health services for pregnant women here.
No.
yeah, my providers see patients as they're pregnant, but it's not the same
Yeah.
Right.
as true prenatal care.
It's
so.
not, the health department has a Healthy Start program for pregnant women, and they have to go to Tallahassee, Panama City, for that. So that is a service there. While Susie's standing up there, we had a donor that I told you gave us some money for some exam beds, and Susie is doing some diligent research. We thought we had some beds picked out, but she like, nah, let me see, this one may work. So that should be coming up pretty soon. We'll have some new exam beds for the clinic.
And
So I guess we will have to get that word out to the community that we do have these new services available in our clinic, correct?
for
For the new doc?
Dr. Dixon?
Yeah.
Well, he's been in the community before, but they pulled back a little bit because they were working on their satellite offices up in the Tallahassee area. But now that they want to bring him back down, he's a very popular physician, very lovely with the patients, so.
And is he only going to be down for certain days, or does he
Yeah,
have a schedule?
they've chosen, he's already done one of the 4 days, and, but they've left some marketing materials up at the Carabel Clinic. I'm going to bring it down here so people are more aware, and his marketing person is going to work with me on trying to get it out, so
Okay.
make it worth their while coming down. So. And in the West Clinic in Apalachicola, we are losing one of our nurses, so we'll be looking with Christy Terry for other candidates to come in. But we'll fill that slot soon, and we have a backup plan, and everything's good. Any questions about what's going on otherwise?
Sounds like everything's going real good to me.
Yeah, we have a really great team, so I'm happy with it. Thank you.
Thank you.
Thank you, thank you, thank you.
Next item is the plant operations report. Mr.
Yeah,
Gibson?
yeah, Craig is not here. He's wheezing a little bit, but he hasn't, somebody he's meeting at the hospital.
I got you.
But he does have his report in the package here. And I know he has a quote for 2 ADA compliant bathrooms that is part of the grant that we have. And so I think he'll need board approval for that. But if you have any questions about his report, you can feel free to give him a call.
Okay. All right, next item on is the CFO. Let's take 5 minutes now and a little break. The mic's gonna be on and we'll go to the CFO report. We need to bump something up on the agenda. And Colleen has got a foundation report, and she's been waiting, so let's bump her up. We're gonna bump her up a little bit.
No, you're good. You're good.
David, appreciate it. I'm sorry, I should have told you, but she's.
I'll be really quick because y'all have mentioned a lot of my stuff already. Hi, everybody. Just a couple updates since last month. You'll recall we had two priorities that we identified. One, can't hear me? Okay. One is supporting the growing clinics, as Mr. Walker mentioned, working with Susie and Courtney, et cetera, others around a couple of things. First, the donation to underwrite some of the improvement in the replacement of the new beds, so working with the team on that. Also, the hospice suite at the hospital. A ribbon cutting may be set for early spring, in addition to a donor drive that we recently did to provide some funding to support that addition of the 3-position family bed. We're working on that. I am just back from some travel, so I have some follow-ups on that, but initial feedback from the communities, they want to help. Then in the area of beautifying things and, what did you call it? Improving our historic structure. We had actually worked closely with an artist in the community. Actually, Mark Shields' wife, Roxanne, has donated for consignment 10 pieces of artwork, beautiful watercolors. They'll all be autographed, signed by her, and then we worked with a local framer. So we have all the framed pieces. There are 10 pieces, so 9 patient rooms, and then something for in the bathroom area in the lobby. Just going to work with Craig to get those hung as soon as possible, and certainly we'll let you know. When we are going to hang them, would love to create a photo op, not only having the artist come, but maybe we could get some of y'all to come and just, be in a photo.
Let us know about a week ahead, okay? If you can.
I'll
if you
try,
can.
sir, sure.
Appreciate it.
But really excited about that. And then we continue to do our donor drive around doing what we can to support other enhancements at the hospital, right? We were looking to bring the bone density screening to the hospital. So we've submitted a grant that we're waiting to hear from Duke Energy, have started talking somewhat regularly with Scott Mixon, who's a really great guy and a big supporter of the hospital. Some more to follow on that. And then finally, just quick update, we have identified we're going again do our gala in November at the same venue. I've been Rising Tides Lift All Boats 2. And so we've secured the date. It will be November 14th. That's a Saturday this year. Have already confirmed the caterer, so the same caterer that was there last year, who people raved about. Would love to have you all join us this year. Details are, in development. However, some sponsorships have already started coming in since we just started pushing it up on social media. Going to wait to confirm some more details before we land on what the ticket price will be. But what's really important is, in order for us to really do our best to raise funds that can then be funneled into the hospital and patient care, is we're looking for sponsors of some of the out-of-pocket costs. So it costs a bit to bring it together an event like that, but the community, basically since about a week after last year's event, people were coming to Bill and I on the street saying, are we doing it? Yes, we're doing it again. It'll be similar. Hopefully it'll be even more fun, and we would love to see as many of you there as we possibly can.
If you make it any better, I don't know how you're gonna do it. That was wonderful.
Well, I think it was great, and make sure you have the same food selection.
Yeah.
The food was real good,
Yeah.
but it was a good environment. Very good time. So we're looking forward to that as well. So.
Yeah, we have some learnings, ways where we can lower some of our overhead costs, get some more people in there. So there are some learnings and more to follow. Then the last thing I'll mention is, again, working with Susie and the clinics and some local businesses. March is National Nutrition Month, so we're going to have a couple of raffles out there. Working, hopefully going to nail down the details with a local food provider to see if we can get a special discount cost to ensure that reinforcing how important good nutrition is and eating healthy food. So more to follow on that. I hope to have an update by today, but given our travel delays this past week, we didn't connect with the vendor again. But some good things happening. The community's really leaning in and wanting to support us. And then, of course, other key milestones. May is National Hospital Week. Going to work with Courtney and the team there. October, World Osteoporosis Day. That gives us a nice inflection point to, again, remind people the importance of bone health, and let's see if we can drive towards that to continue to educate, et cetera. And then November is our Rising Tides event. That's it. Thank you.
Hey, thank you very much. Everything you're doing is just wonderful right there.
Thanks so much.
Colleen does an
You don't do
excellent
the
job.
She does, I
you
can
know.
tell you that right now. I just want you to know.
Bill's just there for the ride, but
You
Colleen
know,
does a great job.
Mr. Bowling with the CFO report. Before Mr. Bowling gets up there, I got a call from our company that does the yearly audit. It's required in the contract. He called the board chair and asked me if I knew of any problems, anything, and all that. And also, he gave me an update. I believe he's going to have a presentation, what, the 14th?
No, March 26th.
March 26th.
Is on my report. Brian Hall will be here to do the audit review, like he always do with the board. And then April 15th, he'll do the same thing with the county commission.
Yeah, both of them. He did tell me, he'd feel comfortable me saying we had a very good audit. Our process is very well. And basically, there should be only maybe one outstanding negative, and it's the one we always have with the not enough people to do stuff right there. And as far as the cybersecurity, he's not going to discuss that. He said we have made strides in it, but it's not going to be open discussion of that. And I guess we could have some one-on-one discussions. That would be a good idea to put our business in the street with that. So I think that's very good.
Yeah, and
David,
one thing
good job there. But he said our process is excellent. The financial process that we have is excellent. We can believe the numbers, and that's basically what he's here for. And the numbers are
And he
good.
mentioned Jason Bonner as well.
He particularly complimented Jason Bonner about how well he was doing. So I'd like to
Fantastic.
say that. I'd like to tell Jason myself if he's on the
Jason's
line.
on.
but-
He's on.
Okay.
Yeah.
Tell him,
That's
okay?
fantastic.
Will you?
Absolutely.
And Duff, I also want to just, Heather, stand up, Heather. Heather's over there. Yeah. Let's give Jason and Heather a hand clap because they really focus on, our team is small. And so you have Jason, Heather, and Sam really worked on the audit, so it's a whole lot of documents, but they do a whole lot of stuff. So I just want to just acknowledge
And
that.
actually, it's a month or a couple of months early, I believe. I mean, it was so smooth, so.
That's good.
So,
That's
good
really
job.
good. Yeah, Jason's on the line. Jason does a fantastic job. So, I mean, and this team here have done a really, really good job. I mean, it's, the audit, and I think you'll hear this from hopefully from Carter Riggs, but, what's important to us is we see the numbers, obviously, in the less adjusting activity is going down, so it's getting better, right? So the integrity of the balance sheet, integrity of the financials, I think you guys got a
One
great
thing too,
report.
I'd like to compliment particularly a couple of board members that know a lot more about this than I do, that ask the right questions.
Yeah.
And tend to improve our financial reporting. So I want to thank y'all. Thank y'all. This is good. Not me. Right there. Bill, you know a lot more than I do, and it's great to have board members that are a lot smarter than me. So thank you.
But John Barry, CPA,
I said, John, I looked at him.
He looked at me, but
John don't want no compliments, but it's John.
You gave a wink to your right, to your
right
left,
up
you
on
look.
that. So
No.
that's great. That's
Thank you.
wonderful.
Thank you, thank you.
So go ahead.
I think
now
John,
the negative side.
That is
Nope.
right. Okay.
We got to take a real hard look at our budgeting process.
Okay.
That makes people think we ain't doing too good
Okay.
when it's overstated.
Sure.
Right? That's all I'll say.
Sure, absolutely, and I think you're, and we'll certainly, this year when we do the budget, look at it in a little more tighter controls around that. But But with that, I want to lead into talking about the January performance and certainly the 4 months of this fiscal year-to-date performance. And I'm going to do the comparison versus the same actual periods in the prior year to give a better reflection. I know, Mr. Berry, I know you had mentioned this last month as well, and I think it'll give a better comparison as to where we're at today versus where we were in this same period in the actual last year. So when you look at the first 4 months, and again, in total, first 4 months of this fiscal year to date, we are a 9/30 year-end facility. So the first 4 months, the consolidated net income did finish at a loss, actual loss of $932,000, as compared, though, to a positive budget of $11,000. So as John referenced, we will look at budgeted numbers when we go into this 2027 year. But this loss as compared to a prior year loss for the same period of $451,000. So in essence, our actual loss for this time of 2026 as compared to those same periods in the prior year did increase $480,000. I'm going to jump in to talk about drivers behind that as for us. So when you look at some key drivers for the month of January's performance, okay? Gross patient revenue, though, our chargeable revenue did finish down $71,000 or 5% versus the actual period in the prior year. Our inpatient revenues, though, were down $84,000. Total patient days down 12 or 24%, again, comparing to the same actual last year. However, our swing bed activity, and this is something I know Courtney just touched on earlier as far as where we're at today, but when you look at our swing bed activity for the month of January, right, we were up as well. We were up with total swing bed days up 30% or 8 days versus the same period last year. Our overall census for the hospital, patients in the house, when you look at inpatient, swing, and observation patients, we did finish slightly, very comparable, relatively flat versus prior year. 2 was for the month, 2.1 last year, so we're relatively flat. Very encouraged to hear what Courtney mentioned earlier. We got 6 in-house today. So that's great to see that. It's great to see that swing bed movement that we're seeing here within Weems. Our outpatient revenues were down approximately $18,000 versus prior year, the same period. Again, as I always state every month in our outpatient revenues, when you look at the financial statements, it does include our ER. Our ER visits were down 79 or 20% versus the same period in the prior year. Our hospital did average during the month of January about 10 ER visits per day, which is down compared to our trailing 12 months. So the previous 12 months, that run rate was around 13 visits. So we're now down in January about 3 visits on a day basis versus where we were. We have, and as I mentioned at the previous meetings, obviously with that lesser ER activity, it does bring lesser labs, lesser x-rays, and so forth that's coming out of our ER. Now, we did pull, I wanted to bring this forward to the board, we did pull some claims data because we wanted to look at, okay, you guys may have heard me month over month here saying our ER has been down. We did pull some actual claims data, so patient claims data for Franklin County, where are patients going? And we have seen, and I want to state this, we have seen from that claims data, and we looked at a 3-year period to see where our trend is going. And some key takeaways that we noted from that actual claims data for Franklin County residents is that we have seen our total market volume down about 10%, with the Weems share down 10% as well. And that Weems share went from 53% 3 years ago to 43% now. And however, where's that going? We have seen that shift move towards Ascension. So that's something we got to, as a board, as leaders as well, address the volume trends that we're seeing with activity that is moving towards that direction. About 9% of that went towards Ascension, and about 1.5% that's gone towards Tallahassee direction. So just I wanted to bring some clarity around, our mentioning of volumes in the ER, because that is, again, the front door of the facility, basically. It does drive a lot of downstream activity and so forth that we do experience through that. So we are going to continue to dive into that and review that. One of the things that I do want to mention, though, is in addition to looking at that market data and seeing volume shift that direction, another important, though, factor to consider is our acuity mix within our ER. And on the flip side of that, when you look at, although some volumes have gone that direction, volumes within the ER, our acuity has held relatively flat and actually increased more on the higher acuity side. So what I'm stating there is that although volume has shifted, some of the lesser acute volume is what we are seeing shift. So just to put some context around that, because I know we analyze from James, and thank you, James, the information he has shared about the transports and so forth. We're not seeing any change mode of transportation of coming in. So it appears, again, on the surface, when you correlate all that information together, that the lesser acute is transporting or mode of arrival themselves, right, taking themselves to the out of our market. So it's things we got to address, and I know that we're putting some through Colleen and Christy and others, obviously putting some more market awareness around our ER and so forth, and there's more to come as we continue to dive into that. But I wanted to bring that to the board's attention, where we are experiencing some of those declines.
David, on that line there, marketing, that was an excellent marketing for, I believe, our radiology. Have you said, you know what I'm talking about there?
Yeah.
It was good. It was very good.
Yeah.
And I think we might do that with the emergency room too.
Absolutely,
Same type
absolutely.
thing.
And one of the things, that is going to be shared at our meeting next week is, we have a hospital that utilized, the rural capital improvement monies that the state of Florida does have allotted towards rural facilities. Did some remodeling, some revamping of their ER. They're going to share their story about how that alone changed a lot of the community perception with the ER, in addition to the quality of care that they continue to provide.
Let me tell you something else too. We got to get some signage. If you don't know where the hospital emergency room is, you ain't gonna find it.
Yeah.
And,
Right.
do what?
I agree.
I think we're looking into that, aren't we, David?
Yeah, Craig is looking into it.
Yeah, we got to get some signage. Just think about it.
Yeah, we'll bring an update at the next
There's
meeting.
nothing there. One little old hospital sign's all I know of.
Yeah, that's the DOT regular little hospital sign there, but Craig is looking into it, and he'll give an update at the next meeting.
Definitely need signage there.
Are you talking about signs
Just a-
outside of the hospital, like pointing in the direction
Yeah,
of,
yeah, around-
this is where the hospital is?
around-
Yeah, we're looking at, right down the street from your
Margaret
house,
Creek
basically.
Library,
Yeah, putting
right
a
there,
sign.
Margaret.
You can put one on my,
Can I put one on-
yard if you want.
Yeah.
The library right there would be an excellent place, I think.
Yeah.
And
We're
I
gonna hit
just
this head
can't
on. I
imagine
mean,
the city wouldn't go along with us on something like that.
Hit this head on, take these ideas. We got to figure, we got to restore, that confidence back to our ER.
A big sign too, not a little one, a big one.
So you did analyze his trips, EMS trips, and there's no increase in the number of going to Ascension, correct?
Not seeing that really within the data.
Okay.
sir.
Courtney, I got a question for you then. How often, have we seen any drop in what the sheriff or prison system has been bringing to the ER?
No, sir, not that I'm aware of. They don't bring a whole lot, but we've seen some recently. And we've also worked with Bill, which I think I mentioned, Bill Williams from the Sheriff's Department, which I think I mentioned last meeting, about putting patients in if they need placement or if they need services when they're being released from the Sheriff's Department.
You're going to see a little change with the prison. I heard they're going to a faith-based population out there, which will tend to be a lot less violent, a lot less injuries, which is good. I mean, that's fine for the folks working there. But you'll see some changes there. I know what happens for a general population. That's the normal population versus the faith-based, which I think I heard that there's gonna make it into. And them folks wanna be there, they're working hard, and they're kind of selected to be there. So we're gonna lose some patients that come from the prison, and with the typical injuries from fights and all that stuff. So that's liable to happen, which is good. I'm glad it's happening. People have it a lot better out there. Go ahead.
So,
Yeah,
so
we're
what
gonna
was the
keep-
basic bottom line with regards to more people moving to Ascension has come into us? What was the bottom line in that research?
Well, we're continuing to analyze that. I mean, that's something we're going to keep bringing forward. One is the first step. We wanted to get the actual claims data to see where folks are going. So I think we got a good basis. And that claims data, again, is captured based on the residents of Franklin County, right? So that's a good solid basis to tell us that we are seeing that trend. Now, why? I mean, I think that's what we're digging into the next steps, is to figure out how do we redirect, how do we change.
So you look at the insurance providers in this process?
It's all claims, yeah, it's all payer claims data. That's correct.
So if anybody's taking their business out of here and directing it more so for Bay County and that, would we be able to see that insurance-wise?
We can see, again, this is all payer claim data, right? So for residents here, where they have gone for care.
Do you associate the insurance
with
provider with that information?
Well, we have it by insurance provider. Now, if you're referencing businesses, that I don't have that dot to connect between the insurance company and what business that's, or that, does that make sense? I don't really know where, if you're asking me about businesses that provide health insurance for their employees and what businesses may be directing, or I don't know that pattern. I know the insurances, obviously. Is that answering your question?
Not really, but that's all right. We'll go over that.
Yeah, we're going to continue to dive into this. I just wanted to bring this forward again, as I've talked in previous months. We're going to keep diving into this to figure this out, to figure out, okay, what do we got to do to restore, to bring that back to the community.
Yeah, and if you look at, another thing, this may be wild, but if you look at the primary care providers, where the primary care providers are sending their patients, they send them to Weems. We know that we have a primary care provider that used to be in Franklin County, but now is in Gulf County now. And he may have patients that he may see in Gulf County, and something may happen, he may refer them over there. Dr. Hart and I was just brainstorming about this as well, so.
That's the type of information I'm looking for.
Yeah. So just think about how can we get that kind of information, what you're saying.
John, we're going to keep digging into this to figure out, because this is very important to this hospital and this community. So we're certainly going to dive into that. And, one of the things, as I just mentioned too, about the acuity, again, like I mentioned, decline in visits related to lesser acute patients. So, when you look at, which lesser acute typically translates to lower reimbursed. So, again, versus the cost of that care being provided. So we're going to continue to dive into it. I'm going to continue to bring it forward as we're tightening up and getting more and more understanding of it. Our outpatient visits, though, did finish slightly down 30 or 11% versus the same period. We did see overall decreases in imaging. However, though, a lot of that was X-ray, just flat X-ray driven, ER down, lesser X-rays and so forth. However, those CTs, I do want to say CTs, ultrasound mammography, those finished relatively flat versus the same period. So we didn't see declines within those modalities of imaging, just on the X-ray side, a lot of it driven from lesser ER activity as well. The rural health clinics, they were up, 28,000 when you look at revenue for the organization versus prior year, although the clinic visits were down, as Susie had mentioned, about 13%. Increase in revenues that we did experience, again, that it's acuity driven. So when you have a little higher acuity being performed within the clinics, although you had lesser activity, it does still translate to higher revenues. EMS revenues were up slightly, 4,000 or 5% versus the same period. James talked about his total billable trips finishing the current period versus the same period in the prior year. Again, that does drive better revenue performance. From a net patient revenue standpoint, we did finish down 154,000 or 20% versus the same actual period in the prior year. And again, that driver behind those decreased revenues was primarily the patient activity with the lesser acute related services I mentioned earlier. Within total non-operating revenues and in comparison to last year, again, another good month for us financially for the 340B program. Although our revenue dollars for 340B were a little bit lower than January of '25, we still brought in good numbers, considering lesser clinic activity, lesser scripts being filled during the month as well. But it still was a positive performance, for the organization with 340B. Total hospital operating expenses, were up 102,000, or roughly 9% versus this same actual period. A couple things I want to mention though versus the same actual period. When you look at personnel costs, obviously it's our largest spend, and I'm including salaries, wages, benefits, as well as any premium labor. We were up year over year versus the same periods. And the primary driver inside of that, when you look at that, is the employee benefits with our medical insurance premiums. We did and have experienced, with our policy renewals and so forth, we did experience up nearly 21% increase in our premiums. So one of the things that we're doing to review and address medical premiums as a whole, as a potential collaborative with other Alliant facilities, we are looking at options to be able to work with our Florida Blue plan and look at ways of helping to reduce across the numbers of and covered lives within the Florida Blue plan. So we are working with them to try to help upon our renewal to bring our premiums down and leverage more numbers, more lives in that across the other Alliant facilities.
David?
Yes, sir.
By taking on the direct payments to the physicians, that's not increasing our salaries any, because we've got an offsetting account with lowering our professional services or professional contracts?
Well, that's to your question there, that is in our pro fees. So when you look at professional fees up year over year, it's up 56,000 versus prior year versus the same actual period. That is by bringing those providers on. Now,
so that's not a
correlation,
driver for increased salaries.
Not salaries, that's right. It's in our professional. But to your point, though, with that increased expenditures, you're seeing an increase in revenue as well, because now we are charging, coding, and billing for those services. So that correlates in the top line, if you want to call it, up in the revenues. It offsets that expenditure in the pro fees. But that is your increase in pro fees. And obviously, the management team here is doing an excellent job focusing and monitoring the daily productivity. Within the hospital, they continue to always, I think you hear Courtney and David, you hear others mention this quite frequently. Frequently, I know Susie mentions this as well. Obviously, when there's downtimes and so forth, we're looking at ways, how can we continue to monitor and lessen any salaries or any types of activities that we need to help control our labor spend. So again, the team does that, and they monitor that on a daily basis. Again, January's month ending performance, just for January alone, a consolidated net income loss of $338,000 on a budgeted positive of 15. So as John mentioned earlier, we're going to address that in 27 when we work on our budgeting process. But we did fall short of the same actual period in the prior year of 187. So I think those, with volumes, as I mentioned earlier, that is kind of the key drivers in some of the lesser performance that we've had for the first 4 months of this fiscal year. I do want to jump in, if there's not any direct comments on the income statement side, I do want to jump over to the balance sheet and cash flow to share with the board and everyone how this certainly translates to cash and so forth, and what's happening within, giving an update for the organization. Overall, our cash position has held.
Do you have a cash flow statement in here?
The balance sheet should be in there. Yeah, the balance sheet.
The balance sheet.
Right. Yeah.
Not a statement of cash flow.
Yeah, I don't think it's in your packet, but we can pull that and share that with you as well. So the overall cash position, for the organization has held steady, even with the slower patient volumes. When you look at, for the first 4 months of this fiscal year, and you look at patient cash collections, I think our collections are down nearly 150,000 year over year for that 4-month period. So although lower volumes, cash collections has held fairly steady considering our decline in volumes. One of the impacts, though, that we are experiencing in cash when you look at a year over year type comparison of overall cash is, our delay currently, or the delay currently with the state, Florida State fiscal year 25 dish payment. And that has certainly impacted the hospital's performance when you look at year over year, because there are delays currently with the state, although the state did, and I know the state did obviously submit their preprint. All that is moved towards, and I know there's a lot of legislation or discussions about that currently. I know even it is at the CMS level currently on approving Florida's plan. So once that, and hopefully that does get moved here pretty quickly, then the state will be able to release, their state dish, their state directed payment program monies as well. But it's currently on hold at the CMS level. All indications that we're hearing politically from our advocacy groups through the Florida Hospital Association and others is that this monies will be released at some point. It's just when, right? So I think we're all in that waiting game. So that has impacted when you look at overall cash year over year. And David, I'm
And that's about $1 million, right, David?
Yeah, roughly. And that's reflected in the books as a receivable, for us as well. So we're waiting to get that cash in the door. So the hospital's days cash on hand, though, did finish at approximately 56 days, which is up from our previous month. Our previous month was around 47 days, so we did have a stronger cash days on hand when you look at the month of January alone. So we're standing there at 56 days. Patient AR, obviously, patient accounts receivables, that obviously is always a focus. AR days did finish January at 80, which is slightly up versus our trailing 12-month run rate, 77. I know the team continues, Heather, everyone on the team continues diligently with that. I know David had made the suggestion with TrueBridge as our billing company to meet weekly, discuss weekly, and I know the team is on it. There is a lot of information that TrueBridge has been providing back and forth with the hospital as well. So, I know they're continuing to work on that as diligently as they can. We also, again, we've included in even sharing more information with the board and with others with a dashboard that's in your packet as well. So I think that kind of helps us all stay in check to see where we do have, opportunities to try to continue to improve our cash position. When you look at other current assets, I just mentioned that, though, that does include that $1 million that we're talking about related to the state dish monies that we're hoping to receive here soon once the CMS decides on the approval of that. The hospital does obviously continue to be very manageable with their AP. There's no vendor payables or relationships at any type of risk. I always like to state that. We AP disbursements, didn't fluctuate too much month over month. I do appreciate, I think, the controls that's in place here with the Finance Committee meeting, and Mr. Zesser doing a fantastic job helping to keep that in check as well as far as reviewing and moving it along. I think that's put a great process in place for us to help us understand, everyone understand, the vendor payables and so forth and what goes into that. Excuse me.
Dave, let me just
Yes, sir.
mention this as well. The revenue cycle piece is very important. When EMS leaves the hospital, we have a person that works part-time that does the EMS billing. We're going to move, she's going to be working with Heather a little bit more, with the revenue cycle piece, because we really want to, I was talking to Jason Bonner, about this, we really want to boost our revenue cycle area up, because you got to be able to have the people in place for that. So that's going to help out a whole lot, with all of that as well.
Yeah, absolutely.
I just want to just add that thought there.
Okay. Just to kind of wrap up, on the liability side of it, talked about AP. We obviously, there are the grant monies and so forth. I talk about this as well. Just continue to always bring clarity around that. Those grants do set in a liability as grants are being put into service. They'll be released out and so forth. So that is still obviously moving. I know you got the renovations. I know that all that is still underway and in process. And again, those monies are sitting in the liability to be released once we put CT and complete that renovation project, put that in service.
Quick question.
Yes, sir.
Going back to you as far as the EMS billings, that'll be done by the county now?
Yes, I guess, James, that department would handle that. Now, we'll help them out as long as we can, you know, with that. But I think they're gonna have their own billing company,
Yes.
right? Yeah,
Are they aware of that?
yeah.
Have they already laid the groundwork, basically?
We're working, that's one of the things, it's one of the things when the new EMS director is named, and hopefully within the next couple of weeks, then they'll start working towards the rest of the infrastructure.
Yeah. But the billing piece has already been, Louis knows that, you know, so we'll continue to do that for EMS until they say, yeah, we're comfortable, then we'll transition over.
Thank you.
And again, that's really from a balance sheet standpoint, I wanted to touch on and close out with those remaining liabilities related to the grants, and you guys just discussed those projects are moving forward. So if there's no questions, hospital, I do want to still mention about the EMS and just bring that update on a few comments there. I know it was mentioned earlier. We did include the budget for the EMS. We included that to March 31st in the hospital budget. So if that does carry over, obviously that's unbudgeted expenditures, unbudgeted activity on the hospital's books starting 4/1 forward. So I did want to mention that because I know that was brought up earlier. But again, from EMS standpoint, just to put dollars around James's numbers that he mentioned earlier, I know that income statement or profit and loss statement is in your packet. When you look at the gross margin for EMS, just for those 4 months of this fiscal year to date, gross patient revenues are flat, basically year over year. Same period, year over year, but operating expenses are up about $15,000 or roughly 1%. So revenues held flat, expenses are up about $15,000. Within that, obviously, is what he mentioned earlier, is the salaries and wages, and that is what's up. The P&L is in the packet. You can see the actual dollars, but that is the difference in the year over year performance currently within EMS. So I wanted to just put some numbers around some of the activity he mentioned earlier. So
I'm going to take you someplace else now. Does Conduit Health Services have anything to do with any of our operations? Have you come across that name?
No.
The reason I bring it up is the largest scam in U.S. history, data breach, has taken place through Conduit. It came out yesterday. They're the ones that supply all the SunPass, backroom operations, and a lot of healthcare operations around the country. So just be aware of it.
No, thank you. It's good to know. And lastly, before I step down, I know you mentioned the audit. I know, and David just talked about the timeline on the audit. Obviously, we were pleased to hear that as well, but I know Brian will share from Carr Riggs. He'll share those results. He'll share those with the county after he presents to the hospital board here as well. And then, the cost reporting process is complete as well for 2025. That has been submitted. Slight receivable, if I recall correctly on the numbers and saw.
$41,000, I think.
Yeah, but a $40,000 receivable from a cost report activity, so that was good to hear and see as well. So I know that has been completed and signed and submitted as well. So, bless you.
God bless you.
But,
I got a question for you.
Yes, sir.
Not about the financial. Are the updated pro forma for
absolutely.
the Carabel Pharmacy, is it?
I was going to mention that as.
Could you plan on giving a little quick
Absolutely.
presentation
I'll
next
plan on a
meeting?
presentation.
Next meeting.
Yeah, I can, absolutely. Yeah,
Okay.
I plan on a presentation with the board's approval to share the updated numbers from the pro forma. Again, the updated numbers indicate, again, more current prescription capture and so forth, as well as the potential 340B impact. And I think the 340B impact has been somewhat, if you want to call it, the wild card because of the activity that's been discussed nationally around the 340B program. But yes, we do have those numbers. We have those ready, and at the board's pleasure and request, I can
Okay,
present
we'll
that
have
next
that on
meeting.
the agenda then, okay? I'll put it on the agenda.
Yeah, I would say, one thing I think we need to do is we need to move forward with that, whether we get any direction from the Board of County Commissioners, whether they want to keep us as a critical access or make us a rural emergency. I think we need to move forward with it as if we're gonna stay as a critical access to
That's
retain
what-
our 340.
That's what we plan on
Yeah.
doing, and I think,
I mean,
when we make a
No more
presentation.
waiting for 'em.
No, it's time to move.
Yeah.
And, we'll make our presentation, to the county, our recommendation on that. But we're gonna have to have assurances to the county that we don't go with the rural hospital model. You know, I mean, that's out of question if we do that. So that, it'll take a little coordination, but I think the first thing to do is get this pro forma.
Yep.
Let's
So
look
what the
at it,
numbers look
have a
like, yeah.
board vote, see what the numbers look like, see how long it's gonna take to recover our money that we put in it. And then move on with the county. If that
Agreed.
suits the board, okay. Go ahead, Dave.
No, that's it.
Yeah,
I mean,
and while David is up there, on my report, of course, I had 3 items that really is a financial item. You know, you had the Weems audit, we talked about that, Medicare cost report, we talked about that. And then the community sponsorship internal control standard policy is in the document here. And so this is the policy that will govern all of our different sponsorships. That's something that came up during the finance committee. And so I need board approval pending Attorney Schuler review of it legally, for this policy.
You covered this with the financial committee?
Yeah, but yeah, this is a policy that we wanted to come up with because we didn't have any, we do sponsorships, community organization sponsorships. And we talked to the auditor, Brian Hall,
Yeah.
and Brian Hall indicated, hey, whatever the county attorney, suggests, go with that. And as we begin to talk, Jason and I, as well with Mike Marone, we thought we need a policy. So this policy would govern, our sponsorships, as a organization, because we didn't have anything in place.
So is that AI generated?
No, this is not AI generated. Jason Bonner?
I read it. I just want to make sure.
Yeah, it's not
Okay.
AI is a wonderful tool, but you got to go back and read what they
Do I have a
produce.
motion to approve taking this to the county attorney?
Yeah, so I just need
Yeah,
approval,
motion.
based on that, yeah.
Second?
Second.
Any more discussion?
No.
All in favor? All opposed?
But
Go
AI
with it.
is a
AI.
wonderful tool, though.
No.
Oh, God.
Chairman, that's all I have, unless there's other questions.
Nothing else. Thank you very much. I think the audit's gonna be outstanding, so particularly, he did particularly mention Jason, so just wanna let you know that.
That's great. Excellent.
All right.
And also, that last thing that's hanging out there, not having enough help, didn't you mention somebody gonna be coming in there to help?
Yes.
And we gotta be able to look at, and I guess you're gonna look at it, how you're gonna divide up those duties
Yeah.
to make sure you stay within the internal control structure.
Sure.
Sure.
And, we've talked about that control, and that is, and Brian will mention this, it's a very common control. We
It
s-
happens everywhere
Everywhere.
because nobody has enough
Absolutely.
in the
Absolutely.
accounting department.
That's right. Very, very
Okay.
common and small.
That it? Anything else?
That's it.
Okay, thank you. Appreciate that.
Okay.
Next item is the finance committee report. Mr. Zester.
Yes, sir. All right, we talked about a couple things at that one meeting. I missed the last meeting because I was stuck up north in a snowstorm, but
Was that fun?
yeah, it was fun. I haven't been shoveling snow in a while, so it was fun. But the committee was talking about a couple things, and maybe James can help us with this. One thing we're talking about is some of the ancillary costs that are associated with Weems supporting the EMS, which is going to end sometime in April or shortly thereafter, I guess. We do share costs with regard to oxygen and other raw materials or services that we provide in conjunction with EMS. So I'm wondering if we've outlined those kind of things. Are you going to take over billing with the same company but through a separate billing, or how are we going to support each other? Or
That's correct. We will, from what we're still in the infrastructure, and once everything gets, once everybody gets hired, or the new director gets hired, hopefully, like I said, within the next couple of weeks, we'll be able to get the infrastructure, and hopefully, I do know that we're going to get vendors. We'll have to get our own. We're going to get our own vendors through the county, so it won't have anything to do with the hospital anymore.
Right.
We have our own, own oxygen. We're contemplating, and like I said, I haven't heard anything further on it, but using Weems for pharmaceuticals, possibly using the what was the thing through using the pharmaceuticals
340B?
with us as county going through the getting pharmaceuticals out of hospital. The Alliance
Discount.
Discount. Yeah.
discount.
Okay.
Using that for our pharmaceuticals.
Okay.
Thank you,
But
Lon.
as
What
far
about
as-
your linen services?
Linens now, we use disposable, so we've been buying our disposable sheets and disposable blankets, and so that has nothing to do with the hospital right now even. So everything will be on our own dime.
Okay.
What'd you
It
say?
might take a little bit to wash that, though. I don't think it's, no, I don't want to get arguing over a pack of rubber gloves or anything like that,
No.
but it's going to take a little time to wash that through, I believe, you know.
But
Little
sooner we can get it going, the sooner.
I know, but it's going to be a little learning process, and I think we work together with this. We're working for the good of the county. I think it's going to work out.
Yes, sir. And purchasing, we won't go through Miss Glenda. We'll purchase we'll do our own purchasing.
Okay.
So, stuff like
Yeah, I
that.
just wanted to make sure that we had thought about unwinding some of those billings that we have. And I think, Mr. Barry, you're the one that, we talked about that at the finance meeting. All right, that's number one. Number two, I think, Mr. Bowling, we talked about Jason putting together a flow chart with regard to how the drugs run through the 340B, because I think a lot of people had some questions again about how that process works,
It's in there.
how all the players within that process make their commission or their income out of that process. And it's in there?
Yeah, it's in your board packet.
It's in the
Okay.
back of it.
It's in here somewhere. Did you take a look at that, Mr. Barry?
No, I just saw it. It's in the back.
I know you were one of the ones that was a proponent to take a look at that.
Well, the main concern about that is I want to I would think the board would too, want to make sure that we're not making a fortune off of the drugs that, on the backs of the people that can't really afford it, you know what I mean? I'm not a politician, but the thing is, if we can get a reduced price, I would hope that they get it at a reduced price.
Yeah, when we looked at the 340B, and Heather can mention this also, I think the patient only paid maybe out of $30-some thousand, maybe $1,000 out of all the patients that we serve. You know, so they're paying very minimal with that, you know, for the drugs with that.
Okay, thank you. That answers some of our
That
questions.
tells it, that's simple right there. Pharmacy sells drug to hospital's uninsured patient, qualifies for discount, pays $20. Hospital short $50, $7 per drug minus 20 paid by the, so, okay. That's pretty simple, man.
Thank you, Jason.
I can understand that. How about that? Thank y'all. Thank you, Jason.
And all the, you know, we went through all of the accounts payable, and everything seemed to be on the up and up, so we don't have any issues with that, right, Curtis? So that's my report.
Okay, thank you. Mr. Walker.
Thank you, thank you. David Walker, CEO here. So my report is in front of you, some bullet points there. And what we'll do, what I'm thinking about doing, in, you know, for my reports, you know, I'm gonna change it up a little bit, so I may do like maybe a PowerPoint for you, and I'll tell you why in a minute. Because when we did the annual report, you know, Christy looks at my report, and we try to grab different things from it, and we're gonna go through this annual report pretty soon. This is kind of like a draft copy, and I may do it like maybe a PowerPoint for you so you can have, and then Christy can grab things out there through the month, you know, from my report with that. So first thing is that compassionate care presentation. Duff and I will conduct a presentation on compassionate care at the Alliance Management Service Governance Retreat coming up this weekend. And I may have to take the mic from Duff as he begin to talk, try to keep him from talking as much during that presentation. So we'll talk about customer service during that time. Secondly, we talked about the annual report. Please take a look at this. Christy Terry, drafted this report. This is our very first one. Really it's capturing not everything that we do, but just some things that we do, so we can begin to, show the community, show individuals, what we're doing at the hospital, what this governing board is pushing and doing as well. When I was talking to the donor, that came to my office, this would have been good to give to him, really, because he was asking different questions about, different services and, how we govern financially and all of that, kind of those type of things. So Christy Terry did an excellent job. Let's just go through it.
No, I'll just go ahead.
So I want to just go through this quickly. So the first page is, the commitment of our community, commitment to care. And then underneath it, we have different sections. We have the governance and oversight and organizational stability section. And right below that, we got certain things that we highlighted under that category. The next category is the financial stewardship and accountability section. We talk about revenue and expense oversight. We talk about the external review and funding readiness as well under that category. Community engagement, the next page, community engagement partnerships. We have education and workforce pipeline, emergency training and community safety, community support and presence, awards, recognitions, and key achievements. Under this section, it would show that, during 2025, these are some of the things that we got awarded with. Oftentimes, we get recognition, but we don't share it. So we putting this in here. 2025, we got the Alliance Management Service Overall Service Award. Hopefully we'll look to pick up another award this year. I'm not politicking, but I'm just saying, coming up. But the foundation, Weems Memorial Healthcare Foundation page, the fundraising efforts and the community engagement. And this got some beautiful pictures in here about our foundation. So this gives us, gives us some of the things that we're doing here. And then, a couple of things I kind of probably had a hindsight that I wanted to add. The CT renovation piece, that was not in there as well. And our ongoing physician and recruitment piece is not in here, so we may make a little tweak. Do you all think, this is our very first one, so next year, as we begin to plan and do this, it'll capture the different things as a board, that you're all pushing down from the hospital and what we're doing. Is there anything else in here that you all think you may want to see?
Yes.
I know we don't have the revenue piece on there, but go ahead, John.
Financials.
Financials, yeah.
The
We don't have
financials for not only us, but for the foundation, right
Okay.
there and there.
Yeah, and so I think, I had on one of my back page, the financials on that, okay. Because I looked at also TMH annual report, and they had their foundation, they had the foundation financials, and they had their hospital financials.
New policies or new controls that you've instituted, that's what the public wants to know. They want to know, what are you doing?
That tells a lot of what we're doing.
Is that something that you didn't think about?
Added diagnostic equipment, ultrasound machine, aerial blood gas analyzer,
Yeah, I was going to add too, with, again, thinking of, appreciate your feedback on this as well, because again, something we've asked Christy, and Christy, works for us and helps support, she helps support other, Florida-based hospitals that we have today. She's also going to be sharing at our next week with everyone about what she is doing to promote the local healthcare across all these various communities. She's going to share these best practices that she has pulled together on these annual reports that she is preparing for everybody. You'll get a chance to see the other Alliant-based facilities that she is supporting us with as well. So you'll get to see what their annual reports look like. And again, this is a best practice that we want to make sure gets out every year. and gets out into the community. And as David said, you know, we get a chance to showcase really what this hospital is currently doing. So any feedback you guys want to add to this, you know, we certainly want to continue to help promote that as well. So
I don't believe in reinventing the wheel. Somebody's doing something
Yep.
real good, we want to do it.
yeah, she's doing a fantastic job with this and helping us with this. Again, it gets that message out there in a clear, concise way, highlights the points and all the hard work that this hospital and this community is doing to support the care here. And I think, as John mentioned too, we can certainly put some financial impacts in there.
Just high level, just high level.
Absolutely.
But
And-
you need to take and also define your swing bed program and how it accesses the local access to help them be able to be here as opposed to other locations. And the 340B program, I don't know if that was in here, but I didn't see the swing bed, nor did I see.
Yes, when you look at page 2, it does have caring for our community by the numbers.
Yes,
And
I
you'll-
saw that, but that doesn't mean anything to people. What, swing bed, you put a swing out in front and rock on it?
Inpatient rehab.
Gotcha.
We'll call it inpatient rehab.
Yeah, yeah. And again, when you look at the numbers there, I mean, that's encouraging to see that patients are choosing here to continue to receive that rehab care. And those numbers have grown, continue to grow, have grown here in 26. You heard me mention that earlier as well, and even into this very month. That's cool.
And another impactful type of display or illustration would be the time it takes to get to other locations via air, EMS and that, and how critical it is to be here.
Your physical location, yeah.
Yeah, and what we'll do, we'll change, because we have inpatient and diagnostic access, we have inpatient rehab service, well, we had swing bed, but we'll change that to inpatient rehab. So when people see that, they understand, you know, what swing bed is. Some people, if you're not in the healthcare arena, you're not gonna know what swing bed is really too much, but inpatient rehab, you will.
Got a question. What is a reasonable time for somebody to see a doctor at one of the clinics? What is our,
Susan, come,
I just,
Wait, come to the
I
mic.
know it's real good, but, I know from me visiting there, but, 15 minutes, could we pretty well say no longer than 15 minutes?
Do you mean them waiting in the lobby, or you mean getting into the office?
In the lobby, till you get out of the lobby.
Yeah, and if it's more than 15 minutes, then we go out and talk to patients, because sometimes we have events happen in the back
Oh, I
room.
understand that, I
Yeah.
understand that.
So, no, we hardly ever have anybody waiting longer than
Yeah,
15
yeah,
minutes.
I think when you look at,
That's something we need to highlight. What about getting blood drawn at the hospital, or x-rays or something?
well, it can vary, because they have somebody in the ED that need an x-ray, if you come in off the street, you're gonna take a back seat to that
Precedence,
patient.
yeah.
Yeah,
You
I
know,
understand.
but I think when you look at increased access to care, you know, one of the things you look at, how long does it take to get an appointment? You know, now, because some physician office, it takes 6 months to get appointments,
Yeah.
or 3 months, but with us, it takes
Right.
a little quicker.
Plus also highlighting, we have x-ray up in Carabel, so if we market that, then some of the outside referring physicians can come in and make appointments to do that.
Right.
So,
Does this is a different question. Does the sheriff's office clamping down on the drug dealers and so forth like that have anything to do with our annuity rate? Elopement rate, whatever you want to call it.
On what rate?
Elopement rate. They don't show up and leave.
I'm not sure it does. I mean, we don't, our numbers are down on our, left without being seen or elopement, yes. But I'm not sure that has
You don't think
much of a
there's a
relationship.
correlation in the amount of enforcement that's going on versus how many of these type of cases are?
I don't think so, because most of those people that leave without being seen or elope are just, for lack of better words, impatient. They don't want to wait. So it's a time issue for most of the cases.
Now, what you would see in the bigger cities, you know, you have sheriff's office or ICE, whatever, you know, your emergency room business may be down because of the undocumented status with that coming into the ED, you know, but we're not we're not having it here. We haven't seen it here with our ED population per se.
Okay. Just on another note, I was thinking about if this is going out to the public, a lot of people probably want to know, and we should talk a little bit more about our emergency room in here, emergency department, and, what's the average wait time in the emergency department? What can you expect if you walk in there with some trauma? How long till somebody's gonna, service your needs? I think that's important for a lot of people in the community to know.
Is there a 24/7, along with your thought process, is there a 24/7 availability in this document?
So you're saying the emergency room, we should state, emergency room open 24/7.
24/7,
And
365.
average wait time is
Yeah.
20 minutes or whatever the hell it is, right?
Well, one more thing with emergency room, that I think that, and I'm not disparaging on, my doctor is a ARNP, but our emergency room is staffed by doctors. Certified emergency room doctors. A lot of places you go, you don't get that. And we need to remember and highlight that.
Promote it.
Promote it, yeah, that's a big issue to me. It's not as much to me, I'll trust some other, but with a lot of people, they want to see a doctor.
Get a picture of Dr. Conrad up here.
Doctors, I think that's something we need to mention. We spend a lot of money for it, so why not mention it, I think that's something. Okay. Anything else, y'all?
All right, so we'll add those things in. So this is something that we're doing, and like I
It's
say,
good, it looks good.
yeah, we'll add in it, and then next year, we'll just build upon it. But this is
Great.
This is very good there.
Where will these go? How will people get them when they come into, how do they, I just wonder, how do they get access to this?
Yeah, what we'll do, we'll put it in our different clinics. We'll put it in some of the different community groups.
Okay, yeah.
How about your hotels?
Yeah, hotels.
And motels.
Yeah, hotels,
Well,
motels.
Spread the word with it,
Yeah.
yeah, the island and everything.
Yeah.
That's a nice
And
looking document.
this also will be on an e-copy as well.
Nice looking document.
And people will also put these in your, what do you call it, your rental package?
Yeah.
You put it in there and it's like Turtle Patrol. Put it in there about the turtles, they'll put it in about this.
Yeah, if they can find the emergency room. If you ain't never been to that emergency room.
Well, you need signage.
I know.
That's what you're
We got to
preaching on,
have
I
that.
know.
Let's make that a priority. with
You,
the
you can work
sign.
with your local realtor groups as well, make sure that's part of,
You can
Oh,
also
materials
get,
pushed out.
yeah. But you can also get Google to make sure they make a big thing about where the emergency room is on their maps.
Well, the other thing I was looking through here is, we don't have phone numbers, email addresses, or you could have, as you said, something that they could pop up the number and maybe a QR code to give them direct access to the hospital through Google Maps, something like that. Because you're bringing this information out to the people, let's give them let's make it a tool that they can use as well.
We'll have Christie add a QR code, for information. And then we'll also look at, what some of the other hospitals are doing. So she did a good job. I know she did one for Calhoun, Liberty Hospital had one, and she may be working with doctors.
Ours has
She
to
did
be
one
better.
Yeah.
David, the other places that are coming to this, the meeting, do they have something like this?
they do, that's what David was just mentioning.
Could
When
they
you look
bring
at
it with them? Could we look at
Well,
it?
absolutely. What
Okay, good.
Chrissy's going to
Good.
share, yeah,
This
she's
is
going to,
great right here,
she's
but
going
I-
to share, she's got her own, she's going to be a presenter, so she's going to share what she has done here and at the
Oh,
other
okay, good.
facilities. Yeah, she's
Well,
going to show
okay,
that
great,
across.
Great,
all.
great, that's
Yep.
good, that's good, okay.
And I have Calhoun's with the mall, because, they don't have
Yeah.
as much stuff, All right, so that's good. And like I say, what I'll do, like for some of our reports, we'll just change my reporting, so when she begin to create this document, she just can look at my PowerPoint, whatever, and just grab information, every month, put to the side for that. Also, we had a visit from the Florida Department of Health, State Rural Health Office to discuss the FLEX program. FLEX stands for Medicare Rural Hospital Flexibility Program. And we talked about different funding initiatives that they could assist us with And one of the things that we really want to do this year, which is part of, I know the financial piece, is charge master review. And so they have some money, it's minimal, that we probably can use, you know, to pay for our charge master review process here at the hospital. And I think that's pretty much it. Oh, my report, we have the audit, we talked about the audit, we talked about Department of Health, Pharmacy Residential Collaboration Program. The multi-view agreement, you know, has been worked out there, so, you know, we hope to sign the agreement pretty soon. You know, that will be a 6-month process to get everything up and running with multi-view. And we talked about Air Methods already. That's the flight company. With their agreement, they really don't want to sign an agreement with us yet until they get their agreement with Calhoun flushed out, so.
Have y'all heard anything about the bill that Representative Schoaf and Senator Simon
Yeah,
sponsored? What's
yeah,
going
well,
on
it
with that?
passed the
Any good
Senate.
news, bad news?
Yeah, the Senate, the Rural Renaissance Bill, it passed the Senate, so the House got to take it up. And they probably take it up later because they're going to use that with negotiations. You got a lot of the property tax. Leverage, because you got the property tax. The House passed a property tax bill, and the Senate hadn't did anything with it yet. So I think it's going to be used for leverage.
Okay, well, we're caught in the middle again. I hope that works out well for us.
And that's all.
Mr. Chairman, do we have a construction committee, or do we have anybody that's pushing on that new hospital, or what we're doing here? I mean, I've been here like 3 or 4 years, and I don't think I've ever heard about a construction committee.
No,
How's that all work?
We can,
I don't know how we do that. I don't know. We have to get,
the county can help us. I mean, not, the hospital board want to have a construction committee for the new hospital.
Yeah, who takes the lead on that?
You know.
Because that money's itching in my pocketbook, and I want to know how we get rid of it.
Well, I mean, if you look at the Board of County Commissioners project list that they put out, I don't know, a couple months ago, I have a copy of it.
they said
that
they kicked it back till next year.
Yeah, they pushed the construction of our ER hospital down the road to 2028. It was on the board for 2026, but it got pushed.
That ain't too far when you start looking at
Well,
numbers and
you know,
getting in their
It's
plans.
been pushed for 20 years, so I mean, how far do you want to push it?
Let's try to stop kicking that can. I mean,
So do the board want to have because what, you know, we can have the board can, you can set up another committee, or you can have a discussion to try to say, okay, let's focus on approaching the county to see, you know, what's going on with the new facility. I know that the county wanted to get EMS out of the way, of course, first as
That was
well.
what I understood.
And then maybe find a partner to partner with the Weems.
What I'd like to do, I think would be prudent to do, is let's get the pharmacy, and then we start with the construction committee or something like that. I mean, we can't do it so much, but if they put, and I'll, you know, when we give our presentation, if they said 28, then we need to start working on it a little bit, you know. So I'm gonna take them at the word, it's 28, so that's the expectations we need to have. And that's not very far, like you said, John.
no, you have to come up with an RFP to give out and get a construction firm,
Well, I know
architectural
all
firm,
that,
all of
but-
that stuff. You know, you should know it.
We got to, you know.
That was all done before, that we had, all that was done before.
But somebody can
Yeah.
pull them off the shelf and brush them off.
Yeah.
Get that dust.
So does the board want to does the board want to establish poll the board members, say, hey, you know, a construction committee or
I have a quick idea.
a
on
capital
that.
outlay or something we can call
I
it?
think you're right, Duff. With the construction of the pharmacy, that's gonna be the first construction we're gonna do, and it's gonna be a small construction job.
Right,
Because we're just
exactly.
gonna have to do some renovation on the interior. So that could be a way for the construction committee to cut their teeth on a small project, to get in line for a bigger project down the road in 2028. So the establishment of a construction committee to work on the Carabel pharmacy might be a good starting point.
It's already in place just about, so that'd be good though. They'd have
Right.
the plans and everything,
Yeah.
it should be in place and everything. So,
I mean, I like what John said, you know, instead of kicking it down the road, let's do something as a,
Well, it's not kicking
as a
down the
hospital.
road, it's setting priorities.
Yeah,
And
as a
28
hospital
is right
board,
around,
yeah.
if we started today on trying to build something in 29 or 30, we probably couldn't get it done. You know,
Yeah.
I mean, I don't know. I don't know how quickly this goes. Y'all are very experienced in it. This new construction they have with the separate units they set in is a lot cheaper than what we were thinking, right?
The market.
Yeah, with modular
Modular
units,
top.
yeah, it is.
I'm sorry, I know you've got to get out of here. I'm
No, I
sorry.
don't. I'm good. I'm good, John. I just found out when I need to leave. I don't have to leave. But that's a good idea. And, how about this? Let's, you know,
You got to establish what you're going to build, so you
Exactly.
can come up with the cost. Then you got to get the finance committee working on how are you going to finance it.
Yeah.
Okay?
Well,
So
John.
all these steps have to take place, and then you got the inspection, CEI, all that other stuff that goes with it.
So what we need to do.
you don't want to do that until you get an approval to
But,
do it. You
but
spend a lot of
definitely,
money.
what we need to do, we need to come back, I think at the next meeting in March, we can come back with the performer. You know, the board, you know, approved that first, you know, then we'll present it to the county, and then we'll start the steps for the pharmacy
Okay.
piece.
Yeah, good.
Because, you know, y'all talking, but we got to, you
Yeah,
know,
we'll do that.
it has not been approved by the board yet, so we got to.
And, I think there's some funding sources too that we can possibly tap into if we get an approval
To go forward.
to go forward. There's some funding sources out there that.
Can be bird dog.
Yeah, that need to be bird dog. Exactly. That's a good thing right there. So, okay, we'll do that. We'll have that on the agenda. Anything else? David?
No, I'm good, thank you.
Okay. Bill, you got anything else about the foundation report?
No, sir.
New business here, the CEO performance evaluation. I think we got a couple folks that hadn't completed theirs, but something I would like to mention, and let's bump that back, the final, till next week. I think it's, and I'm gonna suggest this, I think anybody that does this evaluation needs to sit down person to person with Mr. Walker. I don't know how, I don't think we need to just throw this on. So I'm gonna just ask that the folks sit down with him sometimes, phone, whatever, and have a little conversation before we finalize it with everybody combined. If you don't feel comfortable talking to them about it, that's fine too.
Well,
Isn't that the way, that's the way I always, every one of us are getting, I took my evaluation, I sat down with it, and if you don't want to, but I think that's a good idea to do that. I don't know how I should do it. You know, then we'll come up with a combined, the combined report. Any thoughts on that?
well, yeah, I have a couple.
Okay?
I have agita about being an advisory board as opposed to authoritative board about doing an evaluation on somebody else's employee. He's an employee, Mr. Walker's an employee of
Alliant.
Alliant. And that would normally be where that responsibility falls. The second part of it is, I don't know what Alliant has assigned him as far as what his performance measures are. Now, I think you're probably well aware, there's usually a job description, then there's performance measures, and then you get measured by that as to what you, how you evaluate, and then there's an overall evaluation. I feel, I can't really evaluate him because I don't know what they've assigned him to do.
I don't care what they've assigned him to do. He's in a difficult place. I look at leadership qualities, and has he fulfilled what this board wants done? That's simple. Now, Alliant, they have the same goals that we do, so I look at it like that, and that's why Alliance has a performance appraisal in with ours too. That's the way I look at it.
Well, John, did you go through the evaluation? Did you look at it?
I looked at it, but, I mean, I didn't know what I'm evaluating against.
Well, I think if you look at it closely, it tells you,
Yeah.
you know, leadership. It'll have a line about what they expect leadership to be, and does he meet that leadership quality that they've outlined, and then you mark it down as,
Well,
very good, sort of good,
When did
middle
you
line.
get
one thing I didn't do though, I didn't fill out the Alliant one. I didn't fill that out, because I figured that was for Alliant.
No,
There's actually two separate ones, and there's a Alliant, and then this one I didn't do the Alliant.
Something, I'm confused about something.
No, I mean, it should be, I mean, there should be just one
just one.
form
That's what
that
I-
was
I only
circulated
got one.
to everybody.
Yeah.
There is one form, and it does outline, as you just mentioned, as Mr. Zesser was mentioning, just the various competencies in areas that we do look to, we look for out of a CEO to perform. And so it is, I mean, it is very, detailed. I got a copy of it here. I mean, there's 3 pages here, so if anybody that has, anybody that didn't receive
That's what
one.
Alliant expects of David. That's not what I expect him to fulfill, but that's really two separate sections in there, in my opinion.
Well,
So I just filled out the seconds. I mean, you're drawing straws right there.
Yeah.
And I'll just tell you, I think he's done an excellent job. He's got three sets of bosses. Well, count each other, one as an individual, he's got 10. So I don't know how he juggles it. I always, the old thing you learn in business school, unity of command, is just about gone. With this, it's not there. But, so I filled out the second section. I felt that pertained to me. The first section on there was a line. And that was the way I looked at that, but, yeah.
Kozar
Kozar wants to-
you want to say
Go
something?
ahead, Ms. Kozar.
Oh, okay. I just wanted to add to that. We as Alliant, we evaluate David on the same criteria that you guys evaluate him, and then we combine our scores with your scores to get an overall score for the individual. So I just wanted to clarify that we do the evaluation on the CEO, and we take the information from the board members' input along with our input, and that's where you get the combined score for the individual on their performance evaluation.
Okay. Well, the only thing I'm saying is I look at it from what he does for the board. Okay? And that aligns with what Alliant wants him to do too. And that's the way I looked at that. So I don't know, I do think it'd be better to have Alliant have a separate one than we do, because Alliant might have some intricate expectations that we don't really care about, okay? I don't care if he's 5 minutes late for a meeting with Alliant, but that's your situation. I figure you'd handle it anyway. That's the way I look at it. I just look at it strictly on performance and leadership qualities. That's it, period. And if performance pertains to us, and Alliant probably has some different expectations than me, and so, but I just look at it on that. I think it's all, we're just this bunch of little straws going out there, the same thing. We're talking about the same thing. So, well, you got it. It's something that we're supposed to do, and all I can do is ask you to do it. If you don't want to do it, then we won't. We'll go with whoever sends it in. That's all I know on that. I don't know how to, but I'd go based on your expectations, not Alliance. We can't figure theirs out. So, John, any way you'd like to do it.
I just filled out what they gave me.
I did too.
It's
Let's
not
make it more
fair.
complicated than it needs to be. They sent you a thing, fill it out to the best of your ability.
It's not a popularity contest. It says, you got these responsibilities, financially, management, so forth, and here's how we'd like for you to rank him, okay? That's the evaluation,
Yeah.
okay? It's not a matter, he's a good glad hander, he's a great promoter, and all this other. It's a matter, as a business, I look at the financials. And that's all I really have to go by. We could be thought of as being the greatest in the world, but if we're losing money, and we continue to lose money, something ain't happening right. So that's my 2 cents.
Do,
Yeah,
I
and I
look at
think-
leadership qualities, which will end up being more money for us. Of course, I look at the money, but anyway.
And I just want to, since it's talking about my performance measure, let me just jump in here.
All right, go ahead, delegate for yourself then.
Well, you know,
You're going to defend yourself.
no, I'm not going to defend myself. You know, bottom line is that, you know, here's the performance, here's my job description. Okay, so you got the job description, this stuff that I'm supposed to be doing, you know, and of course we do beyond that. And here's the evaluation. So you look at the evaluation, you say, okay, you know, leadership, you got leadership, then you got financial stuff in here too. You know what I mean? Financial management, finance management, you know, so that's in there. Each board member, you know, probably got different ideas of where I should be at.
Sure.
That's okay. And then you probably add that up, and then from Alliant person view, Mr. Kozar, they both are my direct individual supervisors here as well. You know, I'm being graded by them as well, and then they add the numbers from the board and their numbers up. You come up with something on here. So, you know, and evaluation is not about popularity contests and all that kind of stuff. We understand that, but it's about, you know, what's on the sheet here. You grade the person with that. Now, I mean, I just can tell you, you know, I've been a CEO 6.5 years, really, and it's supposed to be a 2-month deal. Be honest with you, you know, really. And if I wasn't local, I don't think a CEO from the outside probably won't stay this long. To be honest with you, I'm local in the community, vested, really. And so that's some things that we have to also look at. When you look at the CEO position, you know, we had a high turnover, and this is probably the most stable position that we've had here working as a CEO. I'm just saying that, putting that out there because we all know that. But you look at, you do the measurement here, and then you add it together. And for example, John may evaluate me different on the financials than he may evaluate me different on the leadership piece.
That's probably true.
True, I'm just, that's true.
There's no
You know,
problem with that.
you know, Duffy, there's nothing wrong with that. Duffy
There's no
Bill
problem
may
with that.
evaluate me more on a stern communication and relationship. You know, basically, that's whatever the board members, you know, your point of view is, it's okay. Because, you know we're not perfect, you know, there's always room to grow in. But every board member have different things that they're passionate about. You know, Ms. Kroom was always passionate about customer service, you know, really. You know, Kristen Willis is more on clinical piece, you know, so everybody got different things that you're passionate about. And when you go through this evaluation, whatever you're passionate about, that's what you're going to grade, really.
Sure. I know that's.
To be
what
honest
it
with
is.
you, you know,
I've-
so.
I've never had.
I just want to just put that 2 cents in there for you.
I've never had anything where a team evaluated people.
Oh, no.
But I would just ask that the board members sit down, and I think that's the only way to be fair. And I stand by how I evaluated, so when I evaluate somebody, I ain't got no problem with it.
So does everybody have your job description now?
Do they? Everybody? Okay.
Because those were some of the things that when I started looking at, I don't have the measurement tools.
Have you got it now?
I got it now.
He does,
Okay.
yeah, the evaluation form
It
in the
wasn't
job
your
description.
original package. That's why I brought up, it's not
Oh,
a
sure.
popularity contest. It's predicated upon what is expected in the past.
Sure,
I agree. That's
and
fine.
yeah, that
Evaluate
evaluation,
that.
the evaluation
Good
form
with
and
me.
the job description has been
All right.
emailed out to everyone.
Okay. I don't think I left anything out here.
No, you ain't.
No, I think that's it. I don't have anything else. Does any of the board members got anything?
I think that's the next thing right there.
That sounds good to me. Thank y'all. I'll see y'all next month, and we're gonna talk about new construction and possibly, but we're gonna focus in on the
Pharmacy.
pharmacy. Okay, thank y'all.